Plastic surgery, although there's a popular image of it being cosmetic surgery, that's a part of it, but the main bulk of an NHS consultant's work in plastic surgery is around soft tissue reconstruction. By that I mean skin and flesh that's lost through whatever means: trauma, industrial accidents, burns, cancer treatment and so on. The traditional teams that go down to earthquake or any disaster relief are generally orthopaedic teams, which are great teams for dealing with broken bones, but they lack any expertise in dealing with complex crush injuries, and by complex I mean a broken bone plus damage to the skin or the flesh. What we've been trying to do since 2005 in the Pakistan earthquake was get the message out there that if you want to treat patients with these type of injuries, you need to take plastic and reconstructive surgeons with every orthopaedic surgeon. I suppose the way to describe it is chaos. Haiti is clearly a country that with real infrastructure problems at the best of times, and when we arrived there's very little sign of any organisation. We heard a lot of reports of the sort of things that have been on the news: aid trucks, lorries being attacked. Going from Dominican Republic across the border, it was clear that the level of poverty, the difference between the two countries, as soon as you cross the border, the road became a dirt track. Running through a quarry. Right on one side of the border there are people selling all kinds of things. There are very desperate people fighting over selling somebody a bottle of Coke, for example. I suppose the most accurate insight is the patients themselves, because that's the direct contact we have with them. And I found them very similar to other earthquake survivors. In shock by what had happened, very strong considering what they'd been through. Absolutely, there's only two things that terrify them: surgeons and aftershocks, in that order, because they are so worried they're going to have their limbs amputated. I saw on the first day of our assessments at the makeshift hospital we've put up 3 patients who I would very much have liked to have operated on, and but our theatre wasn't ready at that point. We arranged for them to come back the next day. We never saw them again, and I have no doubt why they didn't come back. They were scared we were going to operate. We were going to amputate their limbs. I think that if you take the surgical side, there's no injury I've seen in an earthquake zone that I haven't seen before in some form or other in the UK or in America, as part of my training or as part of my job. However, the sheer numbers do defy belief, and especially the children that are involved. I've got four young children, and I find it that does affect you as it would affect anyone. But sitting at home watching it on TV is actually more distressing for me, because I feel once I'm there, at least I'm contributing to in whatever way I can, and we all contribute in different ways. And so when I'm there, I'm pretty much focused on getting the job done, and we go as a very tightly knit team, and we do support each other. You know, if someone's feeling down about something, or if there's a particularly tragic event that occurs, you know. There was one lad who came in, and we had a slight lull while we were looking for oxygen in proceedings, and he'd had petrol burns as a child, as a baby, and he had this horrific scarring on his face, and he asked me if I'd fix his face for him. So I did, because I had a half-hour gap in the operating schedule while we were chasing oxygen around, and he was old enough not to be oxygen reliant, healthy enough as well, and so I did a bit of that kind of surgery there, and he was very grateful. It bothered him all his life, but it was not what I went out to do. This work, as well as having a lot of harrowing moments and depressing moments, it has equally, at the other end of the scale, huge rewards. You know, you see a kid who comes in flat, who's got sepsis going on, and then 2 days later they're running around and being cheeky. That is an amazing experience.